Hello, radiographers. Hope you are doing good. Welcome to the third part of the MRI elbow joint technique tutorial. So you can see that I have already arranged 6 films from non-contrast elbow joint. So the last one is a T1 team sagittal, and there is 25 sagittal slices in 5x5 layout film. So I have to print them all out, these 6 non-contrast films. So there is 2 coronal, 3 transverse and 1 sagittal. And now it's time for the post contrast images, and you can see the T1 fat set coronal just finished. So let's check them. And this is the T1 fat set coronal, and you can see that there are some artifacts. I got some artifacts, and this is the routine fat set, standard routine fat set protocol. And as the patient's hand is slightly laterally comparing to the center of the magnet, that's why this suppression artifact and distortion artifact comes. And to solve this problem, I have to choose Dixon protocols, and Dixon gives you a homogeneous fat suppressed image. And now I have to search for T1 Dixon. So let's see where I can find T1 Dixon. I am checking inside the protocols, and I'm checking inside the shoulder. T1 3D, no Dixon. And let's check in another folder. Let's see inside the wrist joint, is there any Dixon protocol saved? So there is no Dixon protocol. And in the meantime, let's continue the T1 fat set sagittal. Let's let it play, continue the scan, and in the meantime, let's search the Dixon protocol from the Siemens tree. And from the Siemens tree, I am selecting the long bone. And in the long bone and the T1 protocol, there is no Dixon. In T2, I need T1 Dixon because I have to use it after contrast in ankle. So let's check in the ankle. There is no Dixon. So let's check in the knee joint, and in T1 folder there is no Dixon. So I'm sure there is a Dixon protocol anywhere, so I have to find this. So let's check in the wrist, in the library, and T1, and there is no Dixon protocol. I can remember that I see a Dixon protocol somewhere, so I have to find this. So let's check in the pelvis T1. Yes, I find it. There is the T1 fat set Dixon transverse in the pelvis protocol. So let's drag it down to our main protocol list. So let's drag it down and plan for the post contrast elbow joint. So as this is for pelvis, the Dixon protocol was from pelvis, so that the field of view is large enough. So I have to reduce the field of view and just copy the planning from the previous transverse protocol, and make sure that the positioning mode is selected in ISO center. And if I decrease the field of view, you can see a warning sign. I think decreasing the field of view will solve this problem. So let's see. Right now the field of view is, I think, 360. So changing positioning mode is not working, and the lines are orange color. So let's change the field of view. I decrease the field of view to 150, and you can see that now the lines become yellow. That means now it's okay, and my SNR decreased significantly, but it's okay because I'm using a small flexible coil that will give me a high resolution image even the field of view is smaller. The slice thickness is 4, number of slices is 30 for T1 fat set Dixon transverse. So Dixon always give you a good fat suppressed image in T1. So click apply after the planning, and now I have to make another 2 protocol from the Dixon. Coronal and sagittal. So this is the normal routine T1 sagittal fat set, and you can also see that fat is not suppressed all the way. There are some bright areas that fat appears. And now repeat this Dixon protocol and change the orientation to coronal. And now you can plan on the coronal, for the coronal, and copy the planning from the coronal protocol that you planned before, and increase the phase oversampling to 30 to reduce any slice overlap, to reduce any artifact, aliasing artifact or wrap around artifact, not slice overlapping actually. And this green line actually is shimming field of view. So shimming will give you a homogeneous field of view in your actual anatomical region. So adjusting the shimming field of view is a good practice to get proper good quality image, good high resolution image, and in less noise or noise free image. So for coronal, I am planning over the sagittal and transverse image. So this is the T1 fat set Dixon coronal, and I have to rename the protocol name as coronal. It also remains in the transverse, but I have to rename it to transverse to coronal. So this is the second Dixon protocol that I am planning. So number of slices 23, slice thickness is 3, distance factor is 20, and make sure that the slices, coronal slices covers from the anterior to posterior of the elbow joint. And click apply, and then go to properties, because I have to change the name of this protocol from transverse to coronal. So I am typing coronal and then click OK. So 2 Dixon protocol have been planned, pre-contrast and then post-contrast, and another protocol I have to make for sagittal, post-contrast sagittal. And for this again repeat and open the protocol, for sagittal, and then change the orientation to sagittal, and the plan make turn as sagittal, and you can see that a box appears on the sagittal image and the slices are on the coronal and transverse image. Now angle the uh, slices perpendicular to the elbow joint on the transverse image and parallel on the coronal image. For sagittal image, you have to plan over the coronal and transverse image. So this is the last sequence, post contrast sequence, that I am planning. So I have made 3 Dixon protocol to get a good homogeneous fat suppressed images. And then click apply button. Now let's check the Dixon images. So this is the first Dixon T1 fat set Dixon transverse. So you can see that the Dixon images are better than the previous, although I get some artifact in the left side of the elbow joint, but it's better than the previous routine fat set. And now I have to print this transverse post contrast T1 fat set Dixon transverse series. So this is the T1 transverse post contrast, and now T1 Dixon coronal is running, the second post contrast protocol, Dixon protocol actually. So I am taking another transverse protocol and planned it. I am checking the post contrast images. This is the Dixon transverse. You can also see the artifact in the Dixon protocols also. So to get rid of this artifact, you have to plan the elbow joint as much as possible to the center of the magnet. So as you move the elbow joint far from the center of the magnet, the artifact will be appear. And also I get noise in the images. So send the T1 Dixon transverse images to the filming, and in the filming and change the film layout. So this is the Dixon coronal. You can see the Dixon coronal image post contrast, and it also have noise in the image. Use proper coil if you have the dedicated elbow joint coil or small flexible coil for elbow joint, and place the elbow joint as much as possible to the center of the magnet. So this is the T1 sagittal, and this is the coronal post coronal, and this is the transverse, then print out. So that's it. Thanks for watching. Hope you enjoyed this video, learned something from this tutorial, and this is the end of the elbow joint tutorial. So if you have any question, please ask me in the comment box, and don't forget to like, share and subscribe my YouTube channel. Thank you.